Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. Tonight we're joined by Dr. Anita Kurian, who is the Chief Epidemiologist at San Antonio's Metro Health. And this is our COVID-19 update for the San Antonio community. We're reporting tonight 70 new cases of COVID-19, which brings our total to 44,122 in our community since the pandemic began. This is good news because our 7-day average continues to decline. It's currently at 166 new cases per day. We do unfortunately have a number of new deaths to report tonight, 19 total, which brings the total since the pandemic began to 617. These are deaths that have been fully verified and investigated, and they occurred between June 28th and yesterday. 16 of the deaths are from reviewing death certificates provided by the state to Metro Health, which verified the deaths were in fact COVID-19 related. And again, as we go through these numbers, remember the stories that we are hearing. You heard from my colleague on Friday. These are loved ones and neighbors, colleagues, friends and family. So please do keep all of them and their survivors in your prayers. Tonight we're reporting 603 people in the hospital, which is down 9 from yesterday. 40 new admissions in the hospitals. 267 are in the ICU. That's down 12 from yesterday, and 188 on ventilators, which is down 4 from yesterday. These numbers, again, are all moving in the right direction, and our capacity continues to improve. We do have 56% of capacity, and 56% of ventilators available, as well as 18% of staffed hospital beds available, and so our hospital system is now under high stress, down from severe. That is an improvement from the past month or so. It's Monday, and as you know, we update our progress and warning indicators every week. You can see those on covid19.sanantonio.gov. So let me go through some of those highlights that we're watching weekly to guide our decision-making process. The epi curve is showing a slight but consistent decline over the past 14 days, with some fluctuations in the daily case counts. We are near full capacity in both testing and contact tracing in terms of the number of cases that we should receive at any given time. And for the third week in a row, we are seeing a decrease in the daily hospitalizations. The rate at which cases double, and that again is one of our key indicators with regard to opening up of schools, is now up to 40 days, which is below our target, actually better than our target, and that's a good thing. But the most important indicator that we want to see come down is the positivity rate of cases, and that's the proportion of cases that come back with positive results. Those tests and that rate have declined over the last week again, but the decline is very slow. So it's still at 11.3%, well above the goal of 5% or less. And the hospitals, as I mentioned before, are now in the high stress category rather than severe. Overall, our risk level in the community continues to slightly go down, which we now characterize as moderate. And again, emphasizing we want to see that positivity rate of tests go down. The positivity rate is an indication of how widespread the infection is in the community, and it is still well above where we want it to be. Let me turn it over now to Judge Wolff.
Yeah, thanks, Mayor. And things are certainly looking better. I think one important thing that has evolved is that we're able to do already doing 100% of the cases on tracking every day. That's a significant improvement because now we have things somewhat under control, and very, very important in terms of identifying where that person had been and maybe not leading to other infections. So this is a very, very important piece of it. This is the third week in a row now that we've seen hospitalizations go down. That's a very, very good trend now over a pretty good long period of time. And as you say, we need to get the positive rate down. Hopefully this next week we'll see it even go down more, but we still have a ways to go there. Tracy and I had lunch today with Kenny Wilson. He's the CEO of Haven for Hope, and then with Tullis Wells, who's the CEO of the Konkosky Foundation. Huge foundation which is making a tremendous difference in the lives of us here in San Antonio. It's an extraordinary effort that they're doing at Haven for Hope. Now, you got to remember, these are some of the most vulnerable people in our community. But out of some 1,100 clients that they have, some 300 of them are which are in a hotel, At this point, they have absolutely no positive clients. That's an extraordinary achievement, and they were able to do that by putting in policies early on requiring the face mask, social distancing, sanitation, all of the things that you need to do to be sure and have a safe environment. If they can do that at Haven for Hope, surely any business ought to be able to do that within our community. They really were thankful for the work of Metro Health. You've worked with them and you've really kept them up to date. And then our Bexar County Hospital System, University Hospital, provides a lot of services for them, and they're doing a great job. But one of the important things I think that they've been able to do that we lose track of sometime, that over the last 5 months or so, they've actually taken 400 people and found them housing elsewhere. And so that's a big step in the right direction of trying to address our homeless population here. So, Kenny, thanks a lot for all the great work you guys are doing at Haven for Hope.
Thank you, Judge. And yes, thank you to our team over at Haven for Hope for all the great work that you're doing. I also want to say thank you to all the students out there who may have started schools today. These are very trying times to be starting any grade level, and certainly the teachers and the parents and administrators that are supporting you through distance learning and other activities ought to be commended. We want to urge you to be patient. We know this is not the best situation to be starting schools, but we are going to get there just as soon as we can and as soon as it's safe, and that all requires us to work together. So be mindful of the data, mindful of what Metro Health and the public health professionals are telling us. Let's work together to get that positivity rate down, and we'll start to open up as soon as we can safely. And in the meantime, as always, you can subscribe to the latest on COVID-19 by texting COSA-Gov to 55000 or going to the website at covid19.sanantonio.gov. Dr. Curie and myself and the judge are available for questions.
Judge Wolff, do you know how many clients at Haven for Hope have been tested?
I don't have that number.
Anyone? I don't know if you're all...
asked for the total number of clients at Haven for Hope that have been tested. I don't know if I don't have that, but we can try to get that for you, Rosanna.
Mayor, Judge, the San Antonio bar, The Well, was cited for violating emergency orders for COVID-19. Can you talk to us about this issue, and what do you think about the situation?
It's horrible, absolutely horrible. And I was angered by what I saw on the tape, not just for just the blatant disregard for the well-being of other people, including those that were in that establishment, but also on behalf of all the other small business owners in this community that are trying to do it the right way. So I'm glad that they were cited. The promoter will be cited, and additional enforcement will happen as necessary. We're also going to be deploying a proactive inspection team in those areas that we know are troublesome, because we've been out there before. And we're not going to wait anymore. No more warnings. We're going to shut them down if necessary.
And this team is going to be comprised of what?
Code compliance and police.
You reported another large batch of deaths from the state investigation. Do you guys have a timeline for when the state death counts and your death counts will be reconciled, or is there any kind of target date for when you guys expect that work to be done by?
So it's ongoing. Dr. Curran, if you want to.
Yeah, and like the mayor has already said, it's an ongoing process, and I can tell you, our numbers may never match the state numbers, because there are still number of deaths that we don't agree with, and so our numbers may never reconcile, but it may get closer, and this is an ongoing process.
And so we've modified the way we're reporting this as well, so people can see the numbers as they relate to what the state is reporting. So we have a number of deaths that we are reporting, as always, that are fully investigated, fully verified, and we're putting a separate number there that are deaths still under investigation from the state. Some of those are in dispute, and some of those are just in the process of verification.
Remember, they're using death certificates. In some cases, it's justice of the peace that determine that, hardly the right person to determine whether somebody had passed from COVID or not. In many other cases, physicians and other healthcare personnel have signed without really having a test on COVID. So I think it's important that we do what we're doing in verifying those deaths rather than over-reporting some numbers that may not be true.
How many are still under investigation as of today?
75. Yeah.
Patients at this bar, are there any concerns with Labor Day weekend coming up? I know that there were some changes made to the parks, but is there any other concerns?
I mean, I've got concerns that it's taken a Herculean effort on every to get these numbers to start moving in the right direction, and it seemed like it was as slow as molasses to get to that point. And I'm concerned that, again, everyone's frustrated to be locked up. School is starting. This is not the way we wanted to start school. It's not the way we wanted the fall to play out at all. And that there'll be some complacence and people's guard will be let down. And I'm concerned because if that happens, especially with the positivity rate the way it is now, these numbers could mushroom out of control. So what we're trying to do is make sure we stay vigilant, we stay on message, everybody stays focused on what we're trying to do, and we can get through this as fast and as best we can.
Everybody needs to be reminded that that's why we're in the trouble we got into when the guard was let down, when the governor took away the mandated face mask, when everybody began relaxing. I think it was about a week or two. Yeah. We didn't have our show, so everybody thought things were hunky-dory, and what we do, we ended up in a horrible, horrible situation. So hopefully everybody will remember that. We're not going to be able to let our guard down, and it's going to be several more months, if not longer, that everybody's going to have to continue to do the face mask, sanitation, social distancing if we're going to be successful, particularly through this flu season that we're going to be getting into.
Yeah, and keep in mind, I think that's why the positivity rate is so important, because that is a measure of the proportion of infections, how widespread it is. So that means there is a fire smoldering outside, and if we add kindling to it, it can get out of control. So we've got to do our part and be very patient and focused over the next few weeks.
Dr. Kurian, what do models predict will be at on September 8th as far as cases are concerned?
So I haven't seen the most recent model, but the model that I saw 2 weeks ago, it shows a consistent decline in the number of new infections if this trend that we are seeing at this time continues.
Will that be enough to get our back-to-school rating to the green?
It's difficult to say. Like Mayor has said, our new infections have dropped, our doubling time has increased, but our positivity rate is still high. So we have to watch that positivity rate, which carries most weight as far as the mini-bar index for the school metrics go.
We have a text question from Nancy Tenajero at Telemundo regarding schools. Does the city or Metro Health have a plan in case of a COVID outbreak among students and staff once they've all returned to school campuses?
So our plan for COVID outbreak is going to be exactly the same as any other infectious diseases. You know, the goal of our infectious disease outbreak investigation is always find, stop, and prevent. Find those cases, stop them from spreading further in the schools, and prevent new infections. So it depends upon how big or small the outbreak is. If it is with the amount of community transmission we are seeing, we do expect to see cases in schools. And if there are 1 or 2 cases, you know, we will do the contact tracing around that particular case. And if it's a whole class, then we may have to shut down that particular class or that particular wing of the school. Again, it's difficult to say at this time, but it has to be, it will be incumbent upon or dependent upon the magnitude of the outbreak, how big or small the outbreak is.
Does the city have any plans of doing drive-through flu shots? That's something
something that we are planning to do. At this time, our clinics are open. Our outreach is also being housed at the Frank Garrett Center. Our clinic is on the east side. At this time, the flu shots are being given, is tentatively being planned to be given out of the clinic. But we do have a vaccine group that's come together with our preparedness staff and our immunization staff, and we are looking at that particular component of mass flu vaccination as well.
What would the benefits of that be, drive-through flu shots?
The benefits of any drive-through is to service maximum number of people in short amount of time.
Thank you.